You had a C-section with your first pregnancy. Can you have a vaginal delivery? Talk about TOLACs, Vbacs, and repeat C-sections. In case you're new here, hi, I'm Dr. Allie. I'm a board certified full-time practicing OBGYN. And here on my YouTube channel, we talk about all things that encompass my life as an OBGYN, but I also talk about like lifestyle, fashion, makeup, a bunch of like vlogs and other random things. So welcome. If you are someone that is currently pregnant, thinking about a second pregnancy, but you had to have a C-section with your first baby and you're wondering, what are my options now? This video is for you. It's going to be pretty laid back casual like most of my videos. You can tell a difference. This room used to be my office, but I am pregnant with my second baby and now it's going to be office slash nursery. I'm going to do a nursery tour once this room's actually done, but I'm sitting on the daybed that we have in the nursery, and yeah, I'm just going to sit here and chat with you. Also, I'm going to be drinking my protein smoothie. Gestational diabetes, so I need to increase some protein. So yeah, this is like my mid-morning snack. But without further ado, let's get into it. What I think is really important is to start this video with definitions, because in the land of OBGYN, we use a lot of acronyms like TOLAC, Vbac, RCD, repeat C-section. So let's go over everything. So what is a TOLAC? You guys will hear me say that a lot. A TOLAC is a trial of labor after cesarean section. So it's the acronym for that phrase. And essentially what this means is a patient has a planned attempt to deliver vaginally after they've had a C-section. When you compare that to VBAC, VBAC is a vaginal birth after cesarean section. So VBAC is the result of a successful TOLAC. Does that make sense? So for example, me, I had a C-section with my first baby. So if I was going to attempt, or my desire is to have a VBAC, I would go through a TOLAC, so a trial of labor after C-section, and if I delivered vaginally, then I would be a successful VBAC. That's kind of the terminology there. In this video, we're also going to talk about benefits, risk, who's a good candidate for a TOLAC, and all that good stuff. So let's just jump right in. First and foremost, who is a good candidate to attempt a TOLAC? This is why you clicked on the video, right? You probably have had a C-section or know someone that has, and you want to know, can they even have a vaginal delivery? The success rate as a whole in the United States of having a successful TOLAC or having a VBAC is 60 to 80%. So 60 to 80% of patients that opt to TOLAC have a successful vaginal delivery, which is incredible. Those are really good numbers. 60 to 80% chance, that's great. Does that mean that everyone can opt to undergo TOLAC after a C-section? No, but there is definitely a discussion to be had, and you definitely need to be put in a situation where you sit down with your doctor and you talk about the risks versus benefits pertaining to yourself on whether or not you should attempt a TOLAC. Because like I've said multiple times before, medicine is not one size fits all. So what may work for me and apply to me may not apply to you because you experienced something completely different than my C-section, or the reason I had a C-section may be very different than why you were recommended a C-section. So this is a conversation that you need to have with your provider and talk about risks versus benefits. The person that is the best candidate to undergo a TOLAC or opt to have a VBAC is going to be someone who has had one C-section before and has a low transverse incision on their uterus. Now, this is very, very important. When I talk about incisions, I'm not talking about the incision on your skin. I'm talking about the incision on the uterus. When we do C-sections, there's different ways that we can do them, meaning we can make different cuts on the uterus to get the baby out. Typically the standard of care, and in like, I don't know what percent, but in a high percentage of C-sections, we do what's called a low transverse incision on the uterus. I'll insert a picture here, but essentially you have the uterus and you make the incision on the lower part of the uterus to then deliver that baby out. There's also things called a classical incision, and a classical incision means you make the incision on the top or upper part of the uterus. You go vertical on the uterus as opposed to transverse. There's also things where you do a T incision where you make that low transverse incision, but then you also have to cut upward on the uterus to get the baby out. So it's super important that you know the type of incision that you have on your uterus. Now, the reason this is so important is that if you have had a classical incision, meaning the one that's up and down, on your uterus or a T incision on your uterus, you are not a candidate for a TOLAC. And that is because there's going to be increased risks that could be life-threatening to you and your baby if you go through the process of labor and contractions. So that is one 100% contraindication to a TOLAC is if you've had a classical incision. So this is super important, and make sure you and your doctor talk about this. Other people that are not going to be good candidates to undergo a TOLAC is anything else that's contraindicated to a vaginal delivery, like say you have a placenta previa where the placenta sits right on top of your cervix, you have a history of uterine rupture, you've had prior surgery on your uterus that dealt with that top portion of the uterus. That could also be a contraindication. So make sure you cover these things throughout your medical history with your doctor. But aside from that, most other people are going to be good candidates for TOLAC. Again, it's sitting down with your doctor and weighing the risks versus the benefits. I want to quickly go over a couple things that people ask me all the time if this makes them okay to attempt a TOLAC. One is if you've had more than one C-section. Now, the recommendation from ACOG, or the American College of OBGYNs, is that if you've had one C-section and, like I said, none of those other contraindications, you're a good candidate to undergo a TOLAC. Obviously, talk to your doctor about everything. But if you have had two C-sections, ACOG says that, yeah, you are still able to undergo a TOLAC if you want to, as long as you understand that there's slightly increased risks, but again, they're pretty minimal. I've had patients that have had two C-sections in the past and they really want to try to have a VBAC with their third baby, and they've been successful at it. Again, it just depends. Talk to your doctor to see if that's something that's good for you. And trust me, we'll go over the risks that I'm talking about in a second. The next thing is macrosomia. So this is a situation where you had a C-section, you're pregnant again, and you really want a TOLAC, but your baby is measuring big. Especially towards the end of pregnancy, they're watching you closely. This baby is what we call macrosomic, or measuring very, very large. We do know that with several research studies and looking at the data, that patients that attempt a TOLAC that have a very big baby or a macrosomic baby are less likely to have a successful TOLAC. While it's been done and achieved before, that percentage of 60 to 80% success rate definitely does go down. So you need to understand that while you have a bigger baby and you may really want a vaginal delivery, you could attempt a TOLAC, but it may fail. And unfortunately, if you have a failed TOLAC, meaning you tried to deliver this baby vaginally, but for whatever reason it failed, there are more increased risks with a failed TOLAC needing a C-section. Next is, what if I go past my due date? Can I still attempt to TOLAC? Now, the answer to this is yes, but again, looking at the data and the research that's been done, if you go beyond the 40 weeks, we do know that your chances of having a successful TOLAC goes down as well. So oftentimes I'll sit down with my patients and I'm like, hey, the best case scenario for a successful TOLAC is that you yourself, your body, goes into spontaneous labor on its own before 40 weeks. After 40 weeks, we can still wait and see if your body goes into labor on its own, knowing that the chances of you getting a vaginal delivery, it does drop and go down, and it may not end up being a successful TOLAC. So you have to sit with your patients, or you sit with your provider, and make sure you understand that. Some OBGYNs simply don't feel comfortable doing a TOLAC after 40 weeks because there can be significant and detrimental risks associated with it, but everyone is different. Obviously, you as a patient have autonomy. We as doctors have autonomy in what we feel comfortable doing. So it's finding a provider that you get along with and that you're okay having these conversations with. Twins. If you are pregnant with twins, are you still a candidate to have a TOLAC? And the answer is yes. In the research, they have not found that it makes it more risky or more complicated. If you had a C-section with your first pregnancy and now you're pregnant with twins, you can definitely attempt a TOLAC. That's okay. Obviously, with twins, it can get tricky. You may not be able to TOLAC if the twins are a breech or if their little butts are down. So again, talk to your doctor. Lastly is obesity. Now, they have found that there is a decrease in the success of a TOLAC the higher the BMI the patient is. Does that mean that someone who is obese or someone that has a high BMI, now I say this in quotes because I don't necessarily agree that we need to focus so much on BMI and obesity and all that stuff, but we do know that with obesity, which is a medical condition, I'm not saying like fat or fat shaming or anything like that, but obesity is a medical condition that comes with risks that can affect pregnancy. You do need to be able to talk about those risks so that your patient understands that. So someone who is in the category of obesity has a slightly decreased rate of having a successful TOLAC. So again, something to review with your doctor. It's definitely not something that, like, if I have someone who is obese, I would not allow them to TOLAC. Does that make sense? Like, I would still give them that option if they wanted to. So yeah. Oh, lastly, having to be induced. You had a C-section with your first baby and now you're pregnant with your second, and you develop things like preeclampsia, let's say, or high blood pressure in pregnancy, and your doctor is recommending that we induce your labor at 37 weeks if your body hasn't gone into labor spontaneously on its own. Now, that being said, like I said earlier, the best case scenario for a successful TOLAC is that your own body starts having contractions on its own and you go into what we call spontaneous labor all on your own, and we don't have to give you medications to induce you. Now, we can induce someone that has had a C-section before, but inducing you decreases the rate of having a successful TOLAC. And honestly, inducing a TOLAC, me personally, as an OBGYN, is not my favorite thing. We are limited in the medications that we can use to induce someone with a history of a C-section because there are medications that we would typically use to induce that are contraindicated for someone who's had a C-section. So we kind of get to a point sometimes where our hands are tied and we can't do much to induce your labor, and it could be a long process, and again the success rate of a TOLAC goes down. So I don't love personally inducing TOLACs. Have I done it before? Yes, because my patient desired it. I love it. Do I see that it's as successful as someone in spontaneous labor? No, it's definitely not as successful. If my patient understands the risk, then by all means, we're both on the same page, and I'm going to champion and encourage the desires that my patients want, as long as we're all being safe. Okay, let's quickly talk about the benefits of having a successful TOLAC or getting a Vbac. One, a successful Vbac avoids major abdominal surgery. Like a C-section, it is a major abdominal surgery, and obviously if we can avoid surgery from any standpoint of medicine, it's usually the best option to avoid surgery unless it's absolutely necessary. So avoiding the surgery is so good. Also, having a successful Vbac has a lower rate of hemorrhage, meaning you don't lose quite as much blood, has a lower rate of infection, which is great, has a lower rate of thromboembolism or having a blood clot, all good things. And it has a shorter recovery period than someone who opts to have an elective repeat C-section, which of course we know that recovering from a C-section is typically much harder than recovering from a vaginal delivery. So all good, beneficial thing. Now, what are the risks? Now, the risks of TOLAC, whether you're opting to have an elective repeat C-section or undergoing a trial of labor or TOLAC, both of those carry risks to not only you, but also to the neonate or your baby. Now, the risk of either one of these, again, is going to be things that I kind of listed on the benefit side as well, but there's always risk of hemorrhage. Like I said, it's a slightly increased risk with an elective repeat C-section. Always risk of infection. Again, less risk of infection with a successful Vbac. There's always risk of a blood clot or a thromboembolism, all those things. Like I mentioned before, with the successful Vbac, those tend to go down. And of course, with all things in medicine, there's always a risk of death. No one likes to talk about that, It's very, very, very rare that it happens, but obviously a conversation you need to have with your doctor. And with either an elective repeat C-section or a TOLAC, there's always a risk of hysterectomy. There's always a risk of hysterectomy or needing to take out the uterus in case of postpartum hemorrhage or something like that with any delivery, with pregnancy. But again, it's extremely, extremely rare. Now, most of the maternal risks, so risk to the mother, that occur in this topic of TOLAC versus an elective repeat C-section, we see an increase in these risks when a TOLAC fails. So when a C-section becomes necessary. So for example, you opt to TOLAC, you're in the process of TOLACing, and for whatever reason, you have a failed TOLAC, means you don't get a successful vaginal delivery. So then after you've been in labor and TOLACing for hours and hours, now we have to go and do a C-section. So it's almost like your body went through two things, like attempted labor, it didn't work, now we have to do a C-section. So those risks go up. Bottom line, Vbac is associated with fewer complications than an elective repeat C-section, whereas a failed TOLAC is associated with more complications. All of these risks are associated with a woman's probability of achieving a Vbac. So if you are a good candidate for Vbac, you sit with your doctor, you both decide that this is something that you're high chance of having a successful Vbac, then encourage you to TOLAC. Now, what is the big scary risk with TOLAC? The big scary risk, just took a big drink. The big scary risk with TOLAC, haven't mentioned it before, but it is what's called uterine rupture. Uterine rupture. This is how I explain it to patients in the office and how it makes more sense in my brain because I'm a visual person. Uterine rupture means, remember in the beginning of the video that I said you have a scar on your uterus. Not talking about the scar on your skin, talking about the scar on your uterus. Now, typically in someone who has not had surgery on their uterus, the uterus is smooth. Picture this as my hand. It's completely smooth, there's no bumps, there's no scars, there's no scar tissue, it's just smooth. Now when we talk about someone who has had a C-section, think of it as this smooth section now has, like where my knuckles meet, now there's scar tissue right there. So the tissue is not, it's come together, like we put it back together after the surgery, but there's kind of a weak area, right? There's a weak area in between where we brought the tissue back together. So what happens during the process of contractions and labor is that your uterus contracts and relaxes and contracts and relaxes and contracts and relaxes. Now, what can happen in someone who is having a TOLAC is that that tissue, because it's weaker, can come apart. That is what's called a uterine rupture, meaning the two sides of where you have that scar tissue break open. Now, what's inside of the uterus? The amniotic sac, the placenta, the baby. So this turns into an emergency if you have a uterine rupture, because as soon as that tissue breaks, now you have an emergency for your two patients, your mom and your baby. It becomes a risk to the baby because the uterus rips open. You no longer have a good blood supply to that placenta, so the baby is losing blood because the placenta is not being perfused, and that's what feeds the baby. Also have an emergency for the mom because where that tissue broke open on this edge of the uterus and this edge of the uterus, you have bleeding. So you have a mom that's losing blood really fast, and you have a baby that's not getting perfused and not getting blood. So that becomes an emergency. When a uterine rupture happens, you have to get that patient straight back to the operating room and perform an emergency C-section. I've had to do this before, and everything moves very fast because every second counts at this point. Obviously, that can be very scary, and it can be life-threatening to the baby and life-threatening to the mom. What are the chances of that happening? Very rare. And it's very rare, especially if you've just had one C-section in your life. The chance of you having a uterine rupture after one C-section is less than 1%, so it's rare. Have I seen it happen? Yes, but again, not very often. What are your chances of having a uterine rupture after two C-sections? Again, this is minimal. I'd say at that point, maybe 1 to 3%, but probably less than that. They've done multiple studies and it falls anywhere between 1 to 3%, 1 to 2%, so it's still very low. And if you're okay with that chance and that probability of 1 to 2%, then by all means, that's why patients with 2 C-sections are okay to undergo a TOLAC if that's what they want. Now, when we start talking about patients having a TOLAC after 3, 4, 5, 6 C-sections, it becomes dangerous and it is not recommended to undergo a trial of labor after that many C-sections. We know that at that point, the chance of a uterine rupture is much higher. Same thing with someone that's had a classical incision. Remember that incision that goes up and down? The incision goes up and down, the tissue doesn't heal quite as strongly as someone that has an incision this way. So if you've had a classical C-section, the chance of a rupture is very, very high, which is why we do not recommend that women with classical C-sections ever attempt TOLAC because the chance of rupture is so high. So that's the big, scary complication that can happen and something that needs to be discussed with your provider. I think that's it. Now, in my next video, I'm going to discuss what I am opting to do because I had to have a C-section with my first pregnancy because my daughter was breech. So now that I'm pregnant again, I'm 33 weeks, what am I gonna do? Stay tuned because that'll be the next video. I'm gonna leave you with one thing I wrote down. Always remember, what works for you may not work for other women. So don't compare yourself. And this goes for any aspect of pregnancy. Obviously, specifically, I'm talking about TOLAC, repeat C-section, Vbac, all that stuff. But because it worked for me and because that's what I decided to do, does not mean it's going to work for you. Always keep that in mind because we are all different human bodies. We all heal differently. We all have different beliefs and desires and wants, and that's okay. I just hope and pray that you find a good provider that you feel comfortable having these conversations with. All right, everybody, I will see you in my next video where I'm going to discuss my decision and why I decided to do what I'm gonna do with this baby. Love you guys, and I'll see you in my next video. Bye.